Hey guys, welcome back to my channel, The ENT Resident. Today I'll be discussing a very short topic, and our name of the topic is Rose's position. Now, this is a position that is used in multiple surgeries involving the oropharynx, and we'll be discussing what is the position exactly, what is the purpose of this position, why is this position used, and what are the uses and contraindications of this position. You can also now purchase my notes. I have added links in the description. So, Rose's position is a surgical position which is commonly used during oropharyngeal surgeries. Now, let's describe the position. Now, let's look at the image first over here. So, we can see first of all that the patient is lying supine, and we place a sandbag or a head ring underneath the shoulders. This will cause an extension of the neck, and it will also lead to a slight head tilt backwards. So the head ends up extending at the atlanto-occipital joint. This is what Rose's position is. Now, what is the purpose of putting the patient in this position? First of all, why this is important in oropharyngeal surgeries because this position ends up improving the access and visibility of the oropharynx. Secondly, because of the position of the head lower, it facilitates better drainage of blood and secretions away from the airway. Third, it helps in reducing the risk of aspiration during surgery. And lastly, it improves airway patency as well. So, this position is very, very important for oropharynx surgeries because of all the different four reasons that I have just mentioned. We have to be remembering that you have to be very cautious in patients who have cervical spine issues to prevent any kind of further injury to the spine. So you'll have to be very careful if you have to put the patient in this position for a surgery. You definitely need to make sure that they do not have any cervical spine issues, and even if they do, you have to be very careful with how you handle the patient. Now, what are the different surgeries where we use the Rose's position? Most common is tonsillectomy, which is a very common procedure. It's a bread and butter of ENT surgeons. Next is adenoidectomy, uvulopalato-pharyngoplasty, which we perform in a case of obstructive sleep apnea. Palatal surgeries, for example, cleft palate repair, pharyngoplasty, oropharyngeal tumor excision, base of tongue surgeries, oral cavity tumor resection, foreign body removal from the oropharynx, and even microlaryngeal surgeries. So these are the different surgeries where we use the Rose's position. The last thing we need to know in terms of Rose's position are what are the different contraindications to this position. First of all is any patient who has cervical spine instability or trauma. So, patients who come to you with atlantoaxial dislocation, rheumatoid arthritis, or cervical spine injury, they are at risk of spinal cord injury with the neck extension that we perform in this position. So, these cases are usually contraindicated for Rose's position. Second is congenital cervical spine anomalies. For example, in Down syndrome patients, we see atlantoaxial instability. So, a neck extension in these cases can be dangerous. So, this is a very good and very important MCQ question that you may get in your NEET PG exams, where you can be asked what are the contraindications of Rose's position, and that would be a case of Down syndrome. Next, contraindication is a case of severe kyphosis or spinal deformity. Cases of obstructive sleep apnea, where extreme neck extension can worsen the airway obstruction in the patient under anesthesia. And lastly, in a case of raised intracranial pressure, where neck extension and the venous congestion as a result may end up worsening the cerebral edema. So, this is all about the Rose's position. If you have any questions on this, you can note them down in the comment section and I'll get back to you. Thank you.